All right, I am today with Dr. Elizabeth DiBona and Marian
Yes.
and her assistant, clinical assistant, and we just did a CHROME GuidedSMILE double arch. Dr. DiBona, can you please tell us what was your experience today? You've done several cases with us, and what was different today?
Well, the complexity of today's case was certainly different. We had very little bone to work with once we extracted the teeth, so precision was pretty important today. So the planning for this case was really important. I spent a lot of time reviewing her x-rays, the plans, and gathering my all-star team was also super important, and it was a success.
Excellent. And time-wise?
Time-wise, we started at about 9 and finished at about 2.
Excellent.
Or 3?
No,
Two-
two.
two.
So 5 hours,
Wait,
yeah.
And as the assistant, head assistant, lead assistant here, what is your experience? What you see today that was different than what we did before? We had sedation, we had Dave from BioHorizon here, placing BioHorizon implants, components, chair side support. What was your take on that?
My take on that is I think we worked with a great team. Everybody knew what the next step was, and I really appreciate the efficiency. And I know we will have a very happy patient leaving, not necessarily today after she was asleep for 5 hours, but she will be very happy about the results.
Coming back and so forth.
Yes.
The amount of years of dental training that went into this team is amazing.
Yes.
I mean, you, Thomas, Marion's had, you can say how many years?
45.
45. I've been placing implants for about 13 years. Dr. Dwayne, our nurse anesthesiologist, he's been doing this for a long time, not only doing his anesthetic work, but these types of cases. So, and then our BioHorizons implant rep, Dave, also
And
10
you.
years experience. So this patient, I feel good about gathering this team. This patient got, I think, the best care, the most planning, and that's all we can do. And now hope for the bone to heal strongly.
Well, thank you so much for using CHROME for Roe, and we appreciate your business and look forward to the next case.
Thanks, Thomas.
Thank you, Tom.